Hi, I'm Gary, the ER nurse. Welcome back to my 10-part series on the most commonly given medications in emergency departments. Today, we've reached number 2. Finally. Sodium chloride, NaCl, or normal saline. 0.9% sodium chloride, or normal saline, was established based on in vitro laboratory studies by Dutch physiologist Hartog Jacob Hamburger. His research in the late 19th century incorrectly concluded that 0.9% was the concentration of salt in human blood. It's actually closer to 0.6%. Sodium chloride comes in various concentrations. The most common is the aforementioned 0.9% or normal saline. There's also 0.45% or half normal saline, as well as 3% and 5%. Now, sodium chloride in the normal saline version is an isotonic solution, whereas half normal is a hypotonic solution, and 3 and 5% are hypertonic. Now, when we talk about iso, hyper, and hypotonic solutions, what we're talking about is osmolarity, or solute concentration. Now, imagine you have a divided container with a permeable membrane. On one side, you have 100 mLs of water and salts. On the other side, you have an identical concentration, 100 mLs of water and salt. Now, because they're balanced, there will be no net movement of fluid across that membrane. This is an isotonic situation. Now, if you have one side that has more salt or solute than the other, the side with more salt will draw water from the side with less salt to help balance it out. As this applies to cells, if you give a patient hypotonic solution, there is less solute in the solution compared to the cells. So the cells will pull fluid in. Conversely, if you give a hypertonic solution, that solution will have more solute than the cells, causing fluid to leave the cells. Normal saline is typically used in the emergency department to treat dehydration, hypotension, and metabolic alkalosis. Sometimes it makes ER docs feel better, and occasionally the patient feel better. Now, as mentioned, it comes in 3% and 5%, which are hypertonic solutions, and those are given to patients with hyponatremia, hypochloremia, renal failure, and heart failure, although I don't typically see these in the emergency department setting. Now, in the last decade or so, there have been studies that cast some doubt on the safety of normal saline, particularly in critically ill patients. The SALT-ED trial from 2018 found that balanced crystalloids, such as lactated ringers, resulted in lower incidence of major adverse kidney events than normal saline in non-critical patients. Another study called the SMART trial examined balanced crystalloids versus normal saline in critically ill patients across 5 different ICUs. This trial concluded that using balanced crystalloids like LR decreased the risk of death, dialysis, or long-term kidney problems. Now, I understand this post will likely spark a lot of strong feelings and opinions about normal saline versus LR, and I welcome your comments as well as your anecdotal experiences. Thanks again for watching, and please remember to like, comment, and share, and stay tuned for number 1 on the list of most commonly given medications in emergency departments. I'm Gary, the ER nurse, reminding you to be kind, be strong, prioritize your mental health, and I'll see you next time.